Hi, it's Kelly, and welcome back to Room 9 3/4. Today we will be talking about IO insertion. So I'm going to go over everything that we keep in our IO kit, what it looks like in real life, and then where we can place IOs and kind of how that looks. So first we keep 4 of these in the department. They're in each Room 9 resuscitation bay. We'll get a little closer here. Just a little zipper pouch that has all of your IO supplies in it. So we will go through that. We do keep your drill. Now this is a single battery life drill, so when you hit it, a light will come up here on the back. So this one needs to be replaced because it's red. Most of the time it will be green. We keep extras of these in the management office, and if you ever need one, please let us know. And then we keep 3 different size needles, and we'll go through each one of these. And then we also just keep extra J-loops and flushes in each IO kit as well. So our first size needle we'll go over is our pink needle. It's for patients that are 3 to 39 kgs. Usually we say pink, think pediatrics. It is a pretty small needle in there, as you can tell. Our second size, which is our more medium size, will be the blue needle. This is just for anybody that's 3 kgs and over, a little bit larger than the pink needle. This is kind of one of the ones that we see more often, especially in our tibial IOs. And then the last size that we have is our yellow needle size, and it is for anyone 40 kgs or over. As you can see, it is a very long needle here. Now, you do not have to hub these needles, so we'll talk about drilling and things like that, but this needle does not have to be hubbed into the patient, unlike an IV. So when you open your needle kits, this is what they will look like. So this red piece is where you can put your sharps at that comes out of the middle of your IO. We'll talk about that a little later, but once the sharp goes in, it does not come back out. So for this demonstration, we will not be putting our sharp in here just because we kind of use these for multiple teaching purposes. But in real life, if you can, I know it'll be kind of a hectic scene when you have to use these, but please put your sharps in here because we do not want anyone to get hurt by them. You will also have your IO dressing as well as your J-loop, and then this is an armband that you can stick around the extremity that has the time and date that you place the IO. That is super important because in our hospital, IOs can only be used for 24 hours, and then some sort of other access has to be determined. Different from when you do IVs, the dressing of your IO will go on prior to your J-loop attachment. So you'll put the IO in, you'll put the dressing on, and then you will attach your J-loop and flush your IO. So those are just things that are a little different about placing an IO, and we will take a look here. So your IO needle here, once you remove the cap, it will have these black lines on it, as you can see. Basically what those are to determine what size needle you're going to need. So you will, when initially placing your IO, once you find your insertion site, you will stick the needle through the skin until you hit bone. If you are past this first black line, once you stick this through the skin, then that means you need to go to the next size up. So you need a yellow sized needle. And that is just to determine kind of what depth you need to get into that insertion site that you're going for. So again, humeral IOs a lot of times will be the yellow needle just because there's a lot of muscle and tissue in that area more than there is in the proximal tibia. And so that is a way to determine if you're going to be able to use this needle or if you need to go to the next size up. Once you insert your needle, this part will be in the insertion site, and then you will take this part off. Again, this is the large sharp that needs to go in the red container so that you don't set it in the bed, stick someone else, it gets stuck in the patient, anything like that. So make sure that this part goes in the red box, and then this will be what is left in your patient. Again, you will put your dressing on first, it'll look like this, and then you will attach your J-loop to the IO. So that is how you are going to dress your IO. When doing an IO, you want to ensure that when you flush it, it is very hard. You have to displace the bone marrow that is within that space. So you'll need to flush pretty hard the first time you flush the IO to distribute that. When putting it on your drill, this is just magnetized. So it comes off rather easily. So make sure, you know, when you're going to pull the cover off, again, both of these needles in here are very sharp. So you want to make sure that you're securing it to the drill. Again, you'll stick it into the skin up until you feel bone, and then you're going to want to, in a very steady fashion, push and drill at the same time until you feel the release point. So once you get through the outer part of your bone, it's going to feel more soft and spongy-like. And so how that's going to feel when you place your IO is you're going to drill, drill, drill. It's going to be hard, 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 and then you're going to feel like a pop or a release. And once you get into that release and it's kind of much easier to drill, you're going to want to stop. That's how you know you're in the right spot, and that's another reason why these don't have to be hubbed. You don't want to drill all the way through the bone or anything like that. So once you feel that release, you're going to want to stop drilling, and you're going to want to flush. So the places that we put IOs. You can put them in the humeral head. That is a preferred site. One, it's closer to the heart. Two, it allows for larger volumes of product to be more quickly put into the patient. But I will say it is a harder area, especially in our department. If someone is pericode or coding, there are a lot of people kind of at the head of the bed, around the head of the bed. So that makes it a little more difficult. But that is the preferred site for IOs. The other thing you have to worry about with placing it in the humeral head is the position of your patient's arm. So there is very large nerves and tendons that run down your arm here, and if you do not place your patient's arm in the right kind of area, then you are likely to hit those, and then they are going to be unable to use that arm upon resuscitation. So there's kind of two ways you can do that. One of them is palm over the belly. So you can place your patient's arm with their palm over their umbilicus area. That's going to displace those nerves and tendons. And you want to make sure that the elbow, when you do that, is close to the body. So something like this, almost like you're going to put your patient in a sling, very similar fashion. Want to be laying it over so that you're able to do that humeral head without damaging any structures. The other one you can do is, they call it thumb to the bum. So you are going to stick the dorsal aspect of the patient's hand kind of under the hip here, almost like they're sitting on their hand. That is also going to kind of displace those nerves and tendons so that you aren't damaging anything when you go into them. The other place that you can do is the proximal tibia. There you're looking for the tibial tuberosity. Basically the best way to do it is find the end of the patella. And ways you can find the end of the patella, you can drag both hands down the knee until you kind of catch the patella there. And then it will be 2 fingers down from the end of the patella usually, and 2 fingers over medially. So you want to think big toe, big bone. That is where you're going to want to drill. I'll be showing you at the end of this video where to find your insertion sites on a real person and kind of some tips and tricks to do that. But that is what comes in our IO kits. That is where we put them. Again, they are only good for 24-hour use in our facility. And some contraindications we want to talk about really quick to putting an IO in. So any fractures to the sites that you're looking to put an IO in, any sort of wounds or infection, redness, anything like that might think that it's infected, previous surgeries to the area, if the patient has a history of like brittle bone disease, anything like that, and then previous IO insertions within the last 24 hours. Those are kind of contraindications where you would want to look to another site, or if unfortunately all the sites are contraindicated, you'd want to look at doing some sort of other measures to getting IV access. So again, these are for emergent use only, pericode, coding situations. And we keep these in room 9 in all the bays. So stick around and I will show you insertion sites on a real person and kind of tips and tricks to those. Okay, so we're back to talk about our IO landmarks and insertion sites. So thank you to our special guest John here. We will go first with the humeral head. So again, you want your patient's arm either on their abdomen with their elbow kind of close to the body, or again, you can do the thumb to bum technique as well, either or, to move those nerves and tendons out of the way of your arm. So when you're going to do a humeral IO, the easiest way I have found to do it is you want to stick one hand in the axilla area and then one in the middle of the arm, and then when you bring your thumbs together, you're able to palpate into your surgical neck. Once you find your surgical neck, you're going to go 1 centimeter or one kind of finger width above that, and then that is kind of going to where you are going to want to insert your IO. For the humeral head, you do need to insert at a 45-degree angle. Easiest way to figure that out when you're at the head of the bed is if you stand like you're going to drill at a 90-degree angle and take one step up towards the head of the bed and drill towards the patient's opposite hip. That'll put you right at the 45-degree angle that you need to be at to hit into the humeral head. Again, make sure you put your IO into the skin until you feel that bone there to make sure that you're using the right needle size before you drill. Okay, so for your proximal tibia IO placement, you want to expose your patient's knee area. You want to find the end of their patella. Again, if you're having like a larger person, what you can do is slide your hands kind of down their thigh until you find the end of their patella. Once you find the end of their patella, you want to go 2 fingers down and 2 fingers over, and it's going to be a flat little triangular space here, and that is where you're going to want to drill. Again, medial aspect only, think big toe, big bone, and then you'll want to drill from the other side kind of in at another 45-degree angle here, and that's kind of going to ensure that you're going to hit that right below that tibial tuberosity. So that is where you're going to place your proximal tibia IOs. Thank you to John for all your help on our IO video. Thank you all for watching, and we'll see you next time on room 9 3/4.